Today's lecture is on left bundle branch block. We know that there are two bundle branches. One is the right bundle and the other is a left bundle. So when there is a left bundle branch block, then this needs to be assessed further because usually it represents that some abnormality has been happening and it needs to be probed further. Well, to identify left bundle branch block on ECG is very important because it shows some classical features which one should bear in mind for diagnosing it. Let's discuss these ECG features today. To start with, first of all, we need to identify the width of the QRS complexes, and for a bundle branch block, it has to be more than 120 milliseconds. Over here, we can see the zoom in view, and these are the broad QRS complexes, and their width is around more than 120 milliseconds. So this criteria is being met, and this is one of the foremost important criteria. Next, we need to identify the activation pattern. For that, we need to understand the anatomy of how the electrical conduction system of the heart works. For that, I have shown it on the right hand side. So for the lead V1, there has to be a QS pattern. Here we can see that this is how a heart is placed in the chest cavity, and this is the V1 lead which is recording in front of that heart area. So for that, in a case of a bundle branch block, we know that this is an area of a right bundle and this is the area of a left bundle. So in a case of left bundle branch block, there is a delay in conduction through this area. Well, the conduction is good in this area. So what happens is that in the lead V1, this is placed over here. So the conduction is going away from here, and that's why it will produce a QS complex. Here you can see that. So this is a rule that anything going away from the lead will produce a negative complex, and here we know that the conduction is moving around here. So it will produce a QS pattern over here. Okay. Now ST segment should be opposite to the QRS complexes. By this we mean that look at the QRS complexes. So here we can see that there are positive QRS complexes and there is a negativity in the ST and T waves. So this is kind of disconcordance, and you can see it almost everywhere over here. In AVR it is negative, the T wave is upright. In the chest leads where there are negative QRS complexes, the T wave is upright, and in the lead V4 it's upright and so it's getting negative. So all of these leads are showing the ST segment being opposite to the QRS complexes. Now there is another criteria in the literature which is absent Q waves in the lead V5 and V6. By this we mean that V5, V6 leads are placed over here, and one AVL also represent this area that is being activated. Now we know that in a left bundle branch block, this area is getting delayed activation as compared to this area. So what does this happen now? This area gets activated early, and this area over here will be the last to be get activated. So whenever this is the last area to be activated, the leads representing over here will always show a positivity. There has to be no negativity over here. So we can not see any Q waves of V5 and V6, and this is by what we means that this area is getting delayed activation and there should be no Q waves in these leads. Notching in the lateral leads. Now again the same concept is applied. You can see the notching in the lead V4 and the lead V5 and a hint of notching in lead V6, and we can also see that in lead 1 and AVL. So these are the same leads which are representing this area, and why the notching occurs. Now let's look into that. This can be explained by this slide. For that purpose, look at the lead V1 and V6. This is how they are normally representing the heart activity. So what happens why this notch occurs is because of the delayed conduction in these areas. So I have highlighted them over here for you. So we can see that this initially green area that is activated because it is activated from the right bundle, and the left area, this blue area, is activated by the left bundle. So the first area with the green being highlighted will be this area. So you can see that. So the initial pattern from this to here will be from because of this activity, and the next activation from here to here will be from this blue area, and that is the reason it is the complete activation of the left ventricle, which is split into two halves because of the delay in the left bundle. So the blue area because of the left bundle will get activated later on, and the green area because of the right bundle will get activated early. And that's why we know the pattern of a marrow or William marrow with a M in lead V5, V4, or V6. So this is a classical M which is produced because of these disturbances. The R wave peak time. Now this is the same concept that is applied but in a different way. So by R wave peak time we means from here to the peak of the R, from the onset to the peak of the R. So it has to be delayed because of the same concept as discussed previously. So there is a delay from here to here, and the R wave peak time in these leads, the 1 AVL V5 in V6, they should not be going sharp upwards like this, just like a normal conduction. So they will be a bizarre and different forms can be seen. One of them is with the notching, as we can see it over here. So you can see that there is a delay in the upstroke from here to here. That is the RV peak time. And look at the downslope. It is pretty fast. So it has to be a delayed upstroke of at least 60 milliseconds. So 60 milliseconds is around 1.5 small squares, and we can obviously see that happening over here. So this should be more than 60 milliseconds for a typical or classical left bundle branch block. So in summary, when we can see all these features on an ECG, then this will be called a classical left bundle branch ECG pattern.